part 3 of your Introduction to Community and Public Health. In this module, we're going to have 3 goals to accomplish. We're going to talk about the major organizations involved in public health. We're going to describe the government's Healthy People initiative, and we're going to identify the roles of community health nurses. As always, grab some fun markers and highlighters and pens and a notebook, your study buddy if you have it, and let's get started. Now, there are 6 main organizations I'd like to talk about as it relates to public health: the CDC, the World Health Organization, UNICEF, FDA, NIH, and CMS. Why they all have acronyms, I'm not really sure, but let's get into it. So let's talk through each of these major organizations that are involved in public health, starting with the CDC. The CDC is a federal agency under the Department of Health and Human Services, and its job is to protect the public's health. And they do that both domestically as well as abroad to prevent other illnesses getting into the country. Their goals are to secure global health and America's preparedness for pandemics and other disasters. Their goals are threefold: to secure global health, to eliminate disease, and to end epidemics. And they do a lot of work in educating the public, as well as doing research and mobilizing public health agencies to be prepared for those things. The next agency is the World Health Organization. The World Health Organization was started by the United Nations in the 1940s to address global health issues. Specifically, they talk about global health emergencies, resolving healthcare inequities, and promoting worldwide health. UNICEF is a similar organization, except it's geared towards children's health around the world. The FDA is another federal American agency that is in charge of Food and Drug Administration. So it's in charge of our food supply, making sure that we have safe food to eat, as well as regulating the medications and vaccines that we take. The National Institute of Health is an organization that is focused on medical research to make sure that we have best practices for healthcare in our country. And finally, CMS. CMS stands for the Center of Medicare Services, and it encompasses both Medicare and Medicaid. Now, Medicare is for people 65 and older, while Medicaid is for those who are on public aid or who have end-stage renal disease or meet a few other criteria. Now, Medicare is not free. It is universal health care for those over 65, but patients do have to pay for it. Medicare has 2 parts. Part A covers hospitalization, and Part B covers doctor's appointments. Medicare Part D covers prescription medications. Healthy People is in a government initiative that's been around since 1979, over 50 years. And Healthy People initiatives are updated every 10 years. So you'll hear about Healthy People 2010, Healthy People 2020, Healthy People 2030. And we're always aiming for whichever one is the decade that we're heading towards. It's updated every 10 years, and their mission is to improve health and well-being of all people. And over the last 50 years, this initiative has had great success. It's decreased major causes of death like heart disease and cancer. It's increased preventative behaviors like childhood vaccinations, and it's decreased risk factors like smoking and hypertension. The newest addition to Healthy People is focusing on health literacy. Do people understand information that they're given by their doctors and by their nurses? And are they able to navigate the healthcare system to have better compliance? Now I want to talk about the different roles the community health nurse may have. And before we get into that, we have to talk about the distinct foci that people in public health have. Because people in public health can be focused on populations, communities, public health as a whole, or even global health. So let's define these a little. Population health talks about focusing on groups with common characteristics, like everyone with heart disease, or everyone who has diabetes in the community, or all of the elementary school kids. Population health nurses are going to deliver care to a specific patient group with a similar health issue. They all have the same issue that's identified. Community health is going to be identified for a geographic or common interest group. So did you know, as nurses, we are a community. And so they talk about, mental health care for nurses. That's a community health focus. So it can either be for a town, a city, a camp, but it's a geographic or common interest group. And so in community health, the community is the client. Public health is broader. It really focuses on society as a whole, and all levels of government are involved. And then finally, global health is when we're talking about 2 or more nations. And these are organizations like the World Health Organization and UNICEF that are going to mobilize and unite multiple countries with common interests to improve global health. Global health initiatives can be anything from ending pandemics to increasing gender equality to increasing safe drinking water. There are 2 distinct kinds of nurses you'll see in the community. There's community-based nurses and there's community health nurses. So community-based nurses are based in the community, but they're still doing the same individual one-on-one care of an acute care or clinic nurse. So the client for community-based nurses is still individuals and families, and the focus is still on the management of individuals' acute or chronic illnesses. Their activities still one-on-one, and an example of this would be a home health nurse. Community health nurses, on the other hand, their client is the community as a whole. Their focus is on health promotion and disease prevention. And their activity with patients is more indirect. They're going to be establishing and overseeing programs, not individual people. And so an example of this would be a nurse overseeing a city health department. All right, so we're all signing up to be community health nurses. What's the job? What do we do as community health nurses? Well, there's a variety of community health nurse jobs out there. This is just a short list. Forensic nursing. So you do medical forensic exams at emergency departments or police departments to identify any injuries or collect DNA. School nursing, working at health departments, working at camps. Occupational health nurses who work at large companies to oversee the health of all the employees. Prison nursing, religious-based organizations who have their own clinics to reach out to the community. Home health nursing, and even case management. Now, case management nurses, they are the person who points you in the right direction to go. So case managers aren't doing direct patient care. They're just equipping patients with the resources they need at the time. Do any of these jobs interest you? We'll find out. So what do these community health nurses do out in the community? Well, the Minnesota Department of Health has this public health interventions wheel that lists 17 different interventions. And the wheel here really shows that the focus of these interventions can be on the individual, it can be on the community, or it can be on the system as a whole. And it includes things like social media marketing, policy development, surveillance of illness, screenings for illness, case management, health teaching and counseling, coalition building and community organization, and advocacy. So there's a number of different activities that community health nurses do in these type of roles. That's going to wrap it up for part 3. I'll see you for next part. Remember, you are smart, you are capable, you are loved, and you've got this. See you next time.